Guess who's back? All right, so chapter 34, athletes with disabilities and disorders. The reason why I set it up like that, okay? So I am a firm believer in anybody can do anything, okay? Firm believer. But you're going to come across, especially remaining in this profession, you are going to come across athletes who have disabilities and disorders. It just simply means that maybe something as far as a limb or a body part is not operating at its full capacity. But that doesn't diminish the fact that the player or your athlete is still functioning at 100% cognitive mental capacity. Okay. So oftentimes, for example, with your athletes that might be missing a limb or toe or finger, they are still fully cognitively aware of what's going on, but they just have limited use, a disability, limited use of a particular body part. And same thing with disabilities and disorders, as far as those who might be blind or who might be deaf. Even though they're still cognitively there, they still have the ability to be able to perform a sport. Okay. And how that's possible is that the Americans with Disability Act of 1990 was passed for those as it says, according to the Act, a physical or mental impairment that one substantially limits one or more major life activities. So those you might have paraplegics, and you might see those athletes that are participating in basketball, but it might be wheelchair basketball. Okay, for this is especially important for you to acknowledge, especially for those that are going into teaching and might be going into adaptive physical education. Okay. That doesn't restrict. It does not take away. It just have to be able to accommodate these particular activities for children and or adults to be able to participate in this sport. All right. So doesn't take away from who they are as an individual, doesn't take away their cognitive ability. It just simply means that there is something that is causing some restrictions or there might be some limitations. But if you adapt the physical activity and you adapt things around to meet everyone's needs, not only for those who might have a disability or disorder, but for everybody else. And so for me, that's kind of how I define diversity, okay, and something that is inclusive, okay, inclusive meaning that this sport is for everybody, has no regard to race, ethnicity, ability, wide open opportunity, space and opportunity in sports. All right. So it talks about, I'm not going to go too deep into this lecture because I want you to watch the video by Shaquem Griffin, if I'm saying his name right. I think I am. So amazing, so beautiful. It lets us know that you can accomplish anything. All right. So I do advise a good number of transfer students who do want to come in and eventually be recruited and pulled for a sport. By all means, don't give up on your dreams. I have a younger brother that has that same ambition. Do not give up. Keep pushing, keep grinding, keep going, pushing towards that goal. All right. But watching that video is very motivational. Yeah, it's very motivational. It actually brought me to tears. It's so motivational. But so there are, orthopedic disabilities where there's limited, restricted use of limbs, and it can occur from a birth defect. It can occur from an injury. It can occur from an accident. Okay. The athletic trainer or the coach's role is to understand the needs and the abilities of the athlete. So, as a coach or an future athletic trainer, it's all about kind of catering and designing those needs to be able to fit that athlete, but not only just for them, but for all of your athletes. All right. It's all about, they might just be missing a limb, but they still are cognitively there. And I'm saying that because oftentimes, I'll just use me because I was born in the 80s and I grew up in the 90s where everything was a little different. But it was perceived that just because somebody might be missing a limb or might be missing a finger, that something was wrong with them altogether, that they couldn't do something. So, and I grew up in that era. And you could talk to your parents. Some of your parents probably grew up in that era too, where nobody, disability meant can't do, okay, whatsoever. It just means it's just limited use. So sorry, everybody is looking for me this morning. I didn't do it. All right. So amputation is partial or complete loss of limb, removal of limb. It could be vascular disease. It could like such as diabetes. Could be trauma from an injury. Could be congenital. Meaning that it's something that developed at birth, but later on in life, it just eventually was amputated. The biomechanics is important here. So also maybe another industry you want to look into is biomechanics and orthotic fitting. I do know a couple of people in South Carolina that have businesses in terms of and working with orthotics. And they work with prosthetics, and it's a great opportunity to be able to really make an impact, but also a good opportunity to get into the field as far as helping others. So remember, I think I may have said that in another video, that it's just not always about you. Okay, it's all about what you can help your community do. All right, so there's auditory or visual impairments. There's deafness and blindness. So with blindness, let's start there. Well, either any disorder or disability, you always want to make sure your athlete is safe. Okay, number one thing. It's especially so for those that are deaf and blind. Okay, you want to basically set up the facility or an activity to make sure that nothing falls on them, because you can be fully blind and you can be partially blind, meaning that partially blind being that there's an issue with peripheral vision. Okay, you may not be able to see on the side, or you can only go see but so far. And of course, we know what complete blindness is. But so either way, you want to make sure that they are safe, that there's nothing that's going to put them in danger of falls, something falling on them, and something catching them off guard. So because, as I said, for partial blindness, they may not have kind of the side view vision. So it's very important. Same thing with deafness. You want to make sure that they have protective devices, and you want to make sure that you communicate effectively with them. Okay. At one point, I thought I wanted to do sign language, but it's still not too late, right? So I do encourage you, maybe you want to work with athletes and you might have an athlete that might be deaf. Okay. It's always good to know the basics about sign language or being able to communicate with them effectively. Okay. And then there are cardiovascular disorders. This is a little different. Okay. There might be a lot of limitations of cardiovascular disorders. Okay. You have fibrillation, which is just a rapid heartbeat. And that's when you need to take out and use the external defibrillator, the AED rather. Know your athlete, and oftentimes when there's a fibrillation issue, talk to your athlete. You can find this out on a medical examination that you may have done on an athlete, a pre-participation examination, pre-participation. Whew, so many words. You can find that information out, but maybe there's something going on. So it's good to know what the differences of these disorders are, just so you can establish is this athlete have a medical condition, or maybe this athlete is using a drug. So that's the reason why it's a good idea to know what's going on with your athlete. Okay, and this one is, be mindful of it. It has happened. I have not seen it happen as someone who's worked in fitness. I have talked to a friend of mine who has worked in fitness, who has seen sudden cardiac death. And of course, we've seen it on the field, and there was a colleague of a friend of a colleague who witnessed a volleyball athlete go into sudden, who went down and needed chest compressions and AED. That athlete was revived, but some are not so lucky. So it's so important to know where your AED machine is, where your backup plan is, and how to go about, know your environment, know where things are located, know who to call, know who your facilitator is, know who's going to do chest compressions, and know who's going to be the one to contact loved ones or contact 911. So those things are very important. Transplants, those are different. Where you talked about, you're probably wondering, well, hopefully not wondering, but where organ donations come from. Of course, that's where transplants are able to occur. Athletes will take anti-rejection medication, and that's where the pre-participation physical comes into play, knowing what medications your athletes are on. Most cases, an athlete can participate in a sport. For lung transplants, might be a little different. They might need to know the therapeutic protocol as far as an athlete is concerned who has a lung transplant, but more than likely they're going to be on anti-rejection medications, which does have side effects as far as participation is concerned. But pre-participation examination is your friend. All right, common transplants: heart, lungs, kidney, and liver. Okay, as I said, heart, for the most part, it has to be cleared by the physician for a heart transplant athlete to participate. But the most common one is that there are a lot of athletes with kidney and liver transplants. All do require anti-rejection medication, but there's some that might require additional clearance, like your heart and your lungs. Okay, just requires monitoring by the physician, whomever their therapist might be. They might be under the care of a cardiologist. They might be under the care of someone who is giving them therapy for properly functioning lungs. So those things are just need to be mindful of. But we talked about side effects with anti-rejection drugs. One of the other two side effects is diabetes and hypertension or high blood pressure. All right. So then you have neuromuscular disorders, where you might have someone who might have scoliosis, muscular dystrophy, polio, which isn't really common anymore, but there still are cases out there, and spina bifida. So anything that really impairs the muscles, really impairs the central nervous system, where you have Paralympics where basically, I lost train of thought. Oh, well. Not enough coffee. So we're talking about neuromuscular diseases or disorders such as multiple sclerosis. This is a central nervous system issue where it does impair as far as muscle movement. It causes spasms and balance issues and lack of coordination, and there's some heart sensitivity. Mind you, this is just a disorder. It does not limit that athlete to a sport. Okay, going into more neuromuscular disorders like muscular dystrophy. And you have cerebral or cerebral. There's some, I've heard both. Palsy. Okay. Palsy, what it means is that is paralysis with some form of weakness or tremor. Okay. That's what palsy means. All right. So, but still, someone with cerebral or cerebral palsy can still participate. The symptoms can be mild or severe, or the case can be mild or severe. So you want to watch primarily out for when your athlete has spasms or they have seizures or they're just extremely tired. It's a little different from being tired from a full day, but it's more so just intense fatigue. So you always want to engage in being able to spot them and assist them in certain activities. All right. So closed head injury where there's bleeding on the inside. Of course, we know, as we have studied in another chapter, that we know bleeding on the inside is not good. So it causes pressure on the brain, and so you want to protect the head at all costs. All right. So remember that a disorder and a disability does not mean they can't do. Okay, it just means that there are limitations to a particular activity that you, as a future coach, future PE teacher, and future physical therapist, and future CS strength and conditioning specialist just need to accommodate for. All right, so take your quiz, do well, get those points. Peace.